Dr. Aseem Malhotra is a cardiologist and public health campaigner who has become known for his views on nutrition, lifestyle, and challenging aspects of conventional medical wisdom. He trained as an interventional cardiologist, performing procedures like angiograms and stent placements, before shifting his focus to a more holistic, lifestyle-based approach to managing heart disease. Dr. Malhotra was motivated to specialize in cardiology after losing his older brother to a sudden cardiac arrest at a young age due to viral myocarditis. Dr. Malhotra discusses his evolving views on the COVID-19 vaccine, explaining that he initially supported the vaccine rollout and even appeared on Good Morning Britain to encourage uptake. However, he became concerned after his father, who was otherwise healthy, died suddenly of a cardiac arrest in 2021. This led him to investigate potential links between the vaccine and heart issues. He cites several pieces of evidence that made him question the vaccine's safety, including a reanalysis of the original clinical trials published in the journal Vaccine, which found a higher rate of serious adverse events from the vaccine compared to hospitalizations prevented for COVID-19. He also mentions whistleblower information about inflammation detected in vaccinated individuals' arteries. Dr. Malhotra argues that the benefits of the vaccine were overstated using relative risk reduction statistics rather than absolute risk reduction. He believes that for most people, especially those under 70 without multiple risk factors, the harms of the vaccine likely outweigh the benefits. He acknowledges the vaccine may have provided some benefit to high-risk groups early in the pandemic, but thinks continuing to promote it widely was a mistake. He expresses deep concern about what he sees as a lack of transparency from pharmaceutical companies and regulatory capture of institutions like the MHRA. Dr. Malhotra faced professional backlash for speaking out, including complaints to the Royal College of Physicians, but felt compelled to publish his concerns in a peer-reviewed journal. Transitioning to discuss heart disease more broadly, Dr. Malhotra explains that coronary artery disease involves the buildup of plaque in the arteries supplying blood to the heart. A heart attack occurs when a piece of plaque ruptures, forming a clot that blocks blood flow and causes heart muscle cells to die. He notes that heart disease is a leading cause of premature death globally. Dr. Malhotra emphasizes that about 80% of heart disease is linked to lifestyle and environmental factors rather than genetics. He identifies insulin resistance as a key biological driver of heart disease and explains that diet plays a major role in causing insulin resistance. Other significant risk factors include smoking, high blood pressure, diabetes, and chronic stress. Regarding nutrition, Dr. Malhotra is a strong critic of added sugar consumption. He demonstrates that while the World Health Organization recommends a maximum of 6 teaspoons of added sugar per day, the average person consumes at least 20 teaspoons. He argues there is no nutritional requirement for added sugar and that it significantly increases the risk of metabolic disorders and heart disease. Dr. Malhotra advocates for a diet based on whole, unprocessed foods. He recommends consuming plenty of fruits and vegetables, extra virgin olive oil, nuts, seeds, and oily fish. He states that saturated fat from sources like red meat, butter, and cheese is not problematic for heart health, contrary to conventional wisdom. He is particularly concerned about ultra-processed foods, which he believes should be treated as the new tobacco due to their negative health impacts. Dr. Malhotra challenges the conventional approach to managing cholesterol and heart disease risk through statin medications. He argues that the benefits of statins have been exaggerated and that they come with significant side effects for many patients. For primary prevention, in people without existing heart disease, he states that statins prevent one non-fatal heart attack in 100 people over 5 years without extending life. He criticizes the focus on lowering LDL cholesterol, explaining that the relationship between cholesterol levels and heart disease is more complex than often presented. Dr. Malhotra believes that for most people, the small potential benefits of statins do not outweigh the risk of side effects, and that lifestyle interventions are more effective for improving heart health. Dr. Malhotra emphasizes the power of lifestyle changes in preventing and even reversing heart disease. He discusses research showing significant reductions in arterial blockages through intensive lifestyle interventions, combining diet, exercise, and stress reduction techniques like meditation. He particularly highlights the importance of managing chronic stress, which he says increases heart disease risk, comparably to smoking or having diabetes. For optimal heart health, Dr. Malhotra recommends getting at least 7 hours of sleep per night, eating a diet rich in whole foods and low in ultra-processed foods, engaging in regular moderate exercise, about 150 minutes per week, practicing stress reduction techniques like breathwork or meditation, maintaining strong social connections and relationships. He cautions against excessive exercise, noting that extreme endurance athletes can paradoxically develop heart problems. Dr. Malhotra also emphasizes the importance of social connections and even prescribes hugging to his patients, citing research on the health benefits of physical touch and strong relationships. Throughout the conversation, Dr. Malhotra touches on several systemic issues he sees in medicine and society. He is critical of the influence of pharmaceutical and food industry funding on medical research and guidelines. He argues that much medical knowledge is under commercial control, and that this leads to biased information reaching doctors and patients. Dr. Malhotra expresses concern about a culture in medicine that is resistant to admitting mistakes or changing course when new evidence emerges. He believes there is too much emphasis on pharmacological interventions and not enough on addressing root causes of disease through lifestyle changes. He advocates for greater transparency in medical research and decision-making. More broadly, Dr. Malhotra sees issues like chronic disease, mental health problems, and social distrust as interconnected. He argues that the current economic system and corporate influence have negative impacts on public health and well-being. He emphasizes the importance of acting from a place of virtue and ethics, both in medicine and in society at large. Dr. Malhotra reflects on the influence of his father, who instilled in him values of honesty, integrity, and loyalty. He shares that speaking out about his concerns regarding the COVID-19 vaccine and challenging medical orthodoxy has been difficult and led to personal attacks. However, he feels compelled to do so out of a sense of duty to patients and society. He expresses deep pain at seeing what he believes to be widespread harm from the vaccine rollout and frustration at the lack of open dialogue on the issue. Despite the challenges, he remains committed to his work in promoting lifestyle-based approaches to health and advocating for greater transparency in medicine. In closing, Dr. Malhotra emphasizes the importance of seeking truth and engaging in open dialogue, even when it challenges prevailing narratives. He argues that progress in medicine and society often comes from ideas that are initially controversial. He believes that the qualities that make people truly exceptional are a love for humanity and a desire to give back to society. He also highlights the importance of humility, even among those who have achieved great things. The conversation ends with a call for more counteracting voices in society and the courage to speak truth regardless of consequences.